Hello, everyone. My name is Joy Dolan. I am a current PharmD student at North Dakota State University, and today I will be presenting to you my journal club article regarding the role of probiotics in antibiotic-associated diarrhea. So kind of the agenda for this presentation, I'll start off with a little bit of background about antibiotic-associated diarrhea. I will talk about the study objectives from that article, the historical context, study design, outcomes and analysis, the results of the study, strengths and weaknesses, the conclusion, the clinical significance, the future of probiotics in antibiotic-associated diarrhea, and then a citation. So a little bit of background. So antibiotic-associated diarrhea is a very common side effect when used with antibiotics. It ranges from 5 to 35%, so that's pretty high in most populations. And the main reason why this is a concern is it increases the length of hospital stays, sometimes between 3 and 21 days, which is very significant. It also increases morbidity and mortality, and this includes C. diff infections, but is not limited to this. It also increases the cost to the healthcare system overall. Because you're staying in longer, you're experiencing these complications with your antibiotics and having to take or come in for these symptoms. So, probiotics have been thought to decrease the risk of antibiotic-associated diarrhea and therefore can be able to help with this. Now, why probiotics, you may ask? So, antibiotics often kill or destroy endogenous bacteria in the host's gastrointestinal tract. This you may already know, but a little more specifically how they work. So, probiotics are live microorganisms that are believed to help assist the host microbiome balance in the gut. So, therefore, help create and allow good healthy bacteria to survive and hopefully harm pathogenic bacteria. So what they do is they compete against the pathogenic bacteria for nutrients. They produce exotoxins that prevent enterotoxin of pathogenic bacteria from adhering to the gut wall. So like C. diff has enterotoxin that allow it to adhere to the gut wall and allow it to cause that infection. So having a probiotic may help to prevent that from happening with C. diff. It also may prevent the pathogenic bacterial growth and even trigger innate and adaptive immune system responses to help kill this bacteria or harmful bacteria. So probiotics are also much less expensive compared to a lengthened hospital stay. So a study out of Australia, which was cited in my study article, stated that probiotics are around $10 per day, and a hospital stay is around $1,300 per day. So a very significant cost difference between using a probiotic and very cost effective, if effective. So the study design. So this study objective is to evaluate existing evidence for the use of probiotics in preventing antibiotic-associated diarrhea in adults. That is the main objective of this study. A little bit of historical context. So there was a review that came out in 2017 called the Cochrane Review, and that was referenced many times throughout this article, that really showed that probiotics can have a protective effect, specifically in Clostridium difficile infections and with Clostridium difficile associated diarrhea, and so in the prevention of this. And this review was conducted because it lowered the risk of C. diff infection, but is this able to be applied to other antibiotic-associated diarrhea? A majority of antibiotic-associated diarrhea does not have a specific causative agent, and so can we use probiotics in other areas? It also was supposed to add clarity to if probiotics reduce just the symptoms of antibiotic-associated diarrhea or actually prevent the colonization of bacteria. So, study design. This study is a systematic review and meta-analysis, so it really didn't do its own new study, it just took data from other sources. So it used 42 randomized controlled trials, and that's all it included. It was randomized controlled trials. And then it compared probiotics to either placebo, an alternative dose, an alternative probiotic strain, or no treatment at all. Only prevention studies for probiotics were included. So this means they were not using probiotics to treat antibiotic-associated diarrhea. It was mainly given with the antibiotic in most studies prior to it occurring, in order to prevent the occurrence of antibiotic-associated diarrhea, and only preventative studies were included. It also only included studies written in English. This was due because none of the authors could speak another language. So all of the studies here were written originally in English. Another thing to note, the funding for this study was not disclosed. So outcomes and analysis. So the primary outcome was to evaluate existing evidence of a protective effect of probiotics against antibiotic-associated diarrhea in adults. So again, this did not have any pediatric associations to it. And it specifically measured the incidence of antibiotic-associated diarrhea. It didn't mention anything about severity, just how many times did diarrhea occur when taking antibiotics. The secondary outcome measures looked at the probiotic dose response and then the specific species response. So is there a specific probiotic that would work better? And then how high of a dose of the probiotic? But those were secondary outcomes, so they were not very specific. The analysis also accounted for bias using the Cochrane Risk of Bias tool. And then the data analyzed was using the Cochrane Collaboration computer program. And then subgroup and heterogeneity analysis were also performed. And those subgroup analysis included on the probiotic dose, the probiotic species, and then whether they were using using the treatment or for preventative antibiotic diarrhea in H. pylori treatment. So a majority of these patients often had an H. pylori infection. They were being treated on antibiotics for that. And this study was given a moderate level of evidence using the GRADE approach. And what that is just a way to formulate and have standardization of a level of evidence. So it's just below very high. So high is the highest, and then it's moderate, and then low, and then very low. So this is kind of in between, where they think there's a pretty good idea that probiotics can be helpful in antibiotic-associated diarrhea. So the results. There were 42 studies included, and it included 11,305 participants. 42 out of the 356 articles were eligible to be included. So the original search included 356. The age range for the participants in study ranged from 15 to 85. All of the studies included were randomized control trials, and different probiotic forms and dosages were used. This means there could be yogurt as well as probiotic pills, etc. 32 of the 42 studies reported adverse events. They did not elaborate as to what those adverse events were. They did mention a specific study where 4 adverse events were shown in one study with the probiotic arm and no treatment, but these side effects were supposedly non-serious. Again, they were not mentioned or specific what they were. Also, 6 of the 42 studies had a low risk of bias. The other 36 studies had a high or unknown risk of bias. And then the low risk group of bias showed no protective effect of probiotics. So that's just something to keep in mind when weighing the evidence for this review. So the strengths of this review included that only randomized controlled trials were included. This means that you're having causative evidence from those trials. They included a wide array of patient situations and populations. This may help increase your ability to translate this to a larger population, since it's not like we're only including adults on a certain antibiotic. Gives you a little bit of a broader range. Explained the decision model for which studies would be included. They had a very clear diagram that you could follow to show their thought process as to how they decided to include and exclude articles from their original search. They also evaluated for bias, which I think was good. They also used a risk ratio for their data, which was appropriate considering they were measuring incidence. I also thought it was a strength that they included a table with the characteristics of each study. So if you were curious about a specific outcome, it listed several. So you were able to literally go back and say, okay, which study was this, and pick it out right within the article without having to go to a list of references. The results from other studies are also confirmed with this study. So when the Cochrane Review and the American Gastroenterological Association of Clinical Practice Guidelines and the Role of Probiotics Management also agree with their findings or have had similar findings in the past. They also listed a study that did not line up with their conclusion at the end. I consider that a strength because it shows that they are showing that there potentially could be other studies that show different findings. The particular study mentioned was one study in older adults, particularly greater than 65, that may have a different conclusion. But again, I considered this a strength because it does show that they are showing another side. And then they also used proper statistical testing methods based on their type of data. So some weaknesses that I found with this study, it only studied older adult populations from 18 and older. So this does not have any relation or cannot be tied back to pediatric populations, which also do use quite a few antibiotics. Also, it was only studied the incidence of antibiotic-associated diarrhea, but didn't include any of the duration, how severe it was, did these patients require hospitalization, and what was their quality of life. All of those kinds of things were not accounted for. So it was just, did you have diarrhea or did you not? It also had some evidence for a placebo effect. So some of the studies showed that a 31% difference when compared with placebo, so they were both given a placebo, versus 65% difference if they were given no treatment or probiotic treatment. So that does show that there could be a potential by almost 30% that people who think they're getting something helpful have less incidence of these adverse effects or adverse diarrhea. They also did not classify the type of antibiotic used, the dose, or the duration of an antibiotic. And this is probably because they were combining so many different studies, but it makes it difficult to make clinical application because now you don't know any specific age ranges or any specific antibiotic dosing that would make somebody more at risk. So it's really not a guideline. It just is a maybe helpful in, and that's kind of what this study, and that's why I consider it a weakness. Also, not all the randomized controlled trials were blinded, and this kind of goes back to the same point of placebo effect. If they're not blinded, they may have some bias as to that they might be getting a treatment and they'll feel better. Low bias studies did not find a significant protective effect compared with some of the unknown or high risk of bias studies. So that also makes you think in a low risk, there should be still clinical significance across the board. There could be a due to chance, yes, but that is something to also consider. Also, only studies that were included were studied in English. So that if there's other countries who have had success with probiotics, they may not have been included in this or have had dissuccess. So again, take that with a grain of salt, or take this evidence with a grain of salt. They've also used a title search instead of a keyword search, and that kind of struck me. They may not have even fully been able to cover all of the studies out there, and so there may be more information that they missed in this study because they only used a title search, which maybe gave them more specific results because they only had 356 results at the beginning. So the conclusion, 20 patients need to be treated with probiotics to prevent one case of antibiotic-associated diarrhea. They also found 3 different bacteria in these studies that had the most protective effect to reduce antibiotic-associated diarrhea. This review also backs up other studies such as the Cochrane review because it does show that there is some protective effect. And finally, higher doses of probiotics were found to be significantly more effective, suggesting a recommended dose of greater than 10 billion CFU per day for successfulness in preventing diarrhea. What does this mean for you guys clinically? So, protective probiotic therapy may have a place in patients taking antibiotics who are at high risk for antibiotic-associated diarrhea, but the article did mention to caution the use in patients with lower risk of antibiotic-associated diarrhea. So they also mentioned higher doses of probiotics have been shown to be more protective against antibiotic-associated diarrhea. And then these three probiotic bacteria listed have the most data supporting their use in preventing antibiotic-associated diarrhea. However, overall, there's not enough evidence of how and when to use probiotic therapy. So this review is not a guideline and just prove possible efficacy, but it really gives little to no guidance on actually how to use this research in clinical practice because you don't know which patients are most eligible for it, what antibiotics are most likely to cause this. So where does this leave us? The future of probiotics for antibiotic-associated diarrhea. So the more studies must be conducted to confirm what patients should use preventative probiotic therapy, what antibiotics are most likely to cause antibiotic-associated diarrhea, and at what dose, what age range is most likely to receive benefit from probiotics, and then the proper dosing and duration of probiotic therapy. Here are my study citations. And then thank you for listening. Are there any questions?